First, we have our basin of tepid water. Then we have our bath blanket, fluid impermeable pad, and bath utility thermometer. Next, we have our washcloths, our patient thermometer, a clean hospital gown, and our bath towel. Next, we have our vital signs monitoring equipment, clean gloves, the prescribed antibiotic, an ice bag, and a facility-approved disinfectant. After assessing the patient's condition, you need to obtain the patient's vital signs. After that, you need to verify the practitioner's order. Review the patient's medication record for any recent administration of an antibiotic. If not administered recently, administer an antibiotic as ordered 15 to 20 minutes before the sponge bath, following safe medication administration practices to achieve more rapid fever reduction. After providing privacy and explaining the procedure to the patient, ensure that the room is warm, then raise the patient's bed to waist level. After performing hand hygiene, put on your gloves as needed to comply with standard precautions. Now, place a fluid impermeable pad under the patient to catch any spills. Now place a bath blanket on top of the patient for privacy. Next, you need to remove the patient's gown. Also, remove the top bed linen to avoid getting it wet. Place an ice bag on the patient's head to prevent the development of headache and nasal congestion. Wring out the washcloth before using it so the water doesn't drip and cause patient discomfort. Place the moist washcloth over the patient's major superficial blood vessels in the axillae, groin, and popliteal areas to accelerate cooling. Change the washcloths as they become warm. Bathe each of the patient's extremities separately for 5 minutes. Then bathe the chest and abdomen for 5 minutes. Pat each area dry using a towel after sponging. Avoid rubbing the patient's skin with a towel because it increases cell metabolism and produces heat. Monitor the patient's temperature, pulse, respirations, and blood pressure every 10 minutes or as needed. Notify the practitioner if the patient's temperature doesn't fall within 30 minutes. Observe the patient for chills, shivering, pallor, mottling, cyanosis of the lips or nail beds, or vital sign changes, especially a rapid, weak, or irregular pulse, because such signs may indicate an emergency. If any of these signs occur, discontinue the bath, cover the patient lightly, document, and notify the practitioner. After the sponge bath, ensure that the patient is dry and comfortable. Then dress the patient in a clean gown and cover the patient lightly. Return the patient's bed to the lowest position to prevent falls and maintain patient safety. Remove and discard your gloves if worn. Perform hand hygiene.